Hello, hello. Welcome back to the Heal with Grace podcast. Today, we're going to dive into a conversation that I know a lot of you need to hear because I hear this all the time. What if my doctor has said your scans show something? What if my tests have shown that I have leaky gut? What if my tests show that I have bacterial infection? What if my lab results come back with inflammation markers? Or what if I have a diagnosis of IBS, IC, fibromyalgia, degenerative disc disease, bulge disc, herniated disc, all the above, and so much more? Those are the kinds of questions I'm going to answer today. Is this my body if I have these things going on in my body? A lot of times people are nervous because they're saying, well, it can't be my body. It can't be all in my head because I have these things that are shown, right? I mean, they're real, they're true, they're physical. And yes. They're real, true, physical things that can happen in your body. I have a million of them. I've done all the tests, I've done all the scans. I have multiple diagnoses and multiple different things that are quote unquote wrong in my body. But the thing is that everybody's body has something quote unquote wrong. I don't even want to say wrong. They're just what actually we call in the PRT world, pain reprocessing therapy, normal abnormalities. We have lots of normal abnormalities. Everyone has abnormalities in their bodies because we're human and we're not perfect and we age and things happen. It's just that what I'm going to walk you through today is that the symptoms don't need to associate with those things. I know that can be hard to grasp. It's like I'm telling you to think about your health in a total 180, essentially, right now, because we've all been taught if there's something physically wrong, we need to treat it physically, right? That kind of makes logical sense. But if you're here, you've probably done a lot of those things and they haven't worked very well. There's a reason for that. So that's what I'm going to walk you through today. Okay. First and foremost, let's make something very, your symptoms are real. You are not imagining them. You are not overreacting. You are not broken. There's nothing wrong with you. But your symptoms are very real. There is something physically abnormal in your body. But also, just because something shows up on a scan doesn't mean that's the whole story. Just because you have a set of symptoms that complete a syndrome, that's just a label. That doesn't mean you have to have all these issues associated with it. There's plenty of people who have very similar, maybe scans or things in their body, but they don't have symptoms. And so that begs the question, why? And that's what I'm going to answer. Because here's the thing, we've been taught to believe that the only real health issue are the ones you can point to with a finger, like a broken bone, a tumor, an organ that's failing. And those are obviously 100% real. And those are actually things I'm saying that are not mind-body treatable. Symptoms around them can be, right? We can always help ourselves feel better, but those things need real physical, true treatment. Some other things that just have a syndrome or label to them don't. Most chronic symptoms fall under the syndrome, the label. Okay, you have all these set of symptoms, so we're just going to kind of roll it into this label because we don't know what else to do with it. It's a little messier, it's a little more nuanced, a little more frustrating because they often come from the nervous system itself. There isn't a true physical reason necessarily for that pain and symptoms to be there. So what's actually happening? It's your nervous system's job is not to make you feel good. Its job to make you feel alive. Its job is to be in the known. Your nervous system likes to know what's happening. It doesn't like change. It likes to know everything that's in this moment and just be there or be in the past. So when your brain perceives a threat, whether it's physical, emotional, relational, or even a memory, all of these things can be threats to the brain if we have a high stressed out nervous system. It then sends your body into protection mode. And that protection mode, those danger signals can look like tense muscles, pain signaling signals turned up, digestion slowing down, hormonal shifts, inflammation increasing, blood flow moving away from the healing and into survival. And if that state becomes chronic, You might start to see changes in your body, like inflammation markers do go up. Your pelvic floor might tighten. Your immune system misfires. You get sick all the time. You develop sensitivities to food, sound, or light. You get labeled with syndromes that no one really can explain, like certain pain in your body or scans that show you have things like leaky gut. So, yes, your scans might show something. Yes, your labs might be abnormal, but that doesn't mean the issue is permanent, structural, or unchangeable. It could mean that your body's been stuck in a loop of protection, and that's a very different conversation. Let's talk about diagnosis for a second. There's a difference between a structural issue and a functional pattern, as I alluded to earlier. So, a structural issue are things like a broken bone, organ failure, a severed nerve. Those things, yeah, they need to be treated from a physical standpoint. Maybe you have a tumor. Yeah, that needs to be treated. Again, most chronic conditions are functional, meaning your body is functioning in a disordered pattern, but nothing is permanently broken or wrong or is unchangeable. You've probably heard you have this syndrome, you have this thing, and it's untreatable. Things like fibromyalgia or IC or even chronic fatigue or long COVID. People are told we don't have a cure for it. We don't have a treatment for it. That's a whole other episode because that can just be a whole other layer on top of what you're already experiencing that is so difficult to deal with, right? There's fear, there's scared. You're scared. You're like, well, then what do I do? I'm telling you, I'm here to change that. I want to change that. I want you to know that it's so possible to shift and actually change some of those things. Some of these things include things like IBS, interstitial cystitis, fibromyalgia, chronic migraines, TMJ, herniated discs, degenerative disc disease, chronic fatigue, long COVID, POTS. I mean, the list can go on and on and on. All of these things can be treated mind body. And there is research to back it up. It is not just me saying it. And I will link all of those below. I will link the book resources and the research resources so that you can check them out if you would like to see them. So, really, what I'm saying, yes, even if you were told that there's a disc, you were told it's out of place, it may not be the reason for your pain. Because studies show that many people with these findings on scans have no symptoms at all. So, again, this is not about ignoring the physical. It's about expanding the conversation to understand the whole body and that we have emotional and mental patterns that contribute to our physical pain. Actually, not even contribute, are the root cause. So, if your healing plan doesn't include that, you are very much so missing the most powerful lever you have, the most powerful tool you can use in your life. This work literally will save your life if you tune in, if you learn, if you allow yourself to go there, if you open to it. You're going to have a lot of resistance. Your body, your mind is going to be like, that's bullshit. Or your mind is always want to keep looking for something physical that's wrong so that you can treat it and move on. Because this work is our own work. Like you have to do it. We have to do it. But it'd be really nice if there was just some kind of physical treatment you could go do and you'd be all better, right? Totally. I'd love to give you that. I'd love to give myself that sometimes. At the same time, I will say this has been some of the most transformative work I have ever done. And that says a lot because I've been in the healing world and therapy for 20 years and I'm not even that old yet. So I'm only 34. And I mean, it just did. Like, yeah, it's hard. But it's completely changed my life and how I see myself and how I approach the world and how I approach my relationships. And it's some of the deepest healing that we can do. And that's why I'm just so passionate about it. And not only that, but also because it can change your life. You don't have to be in pain or symptoms the rest of your life. It can change. Your nervous system impacts every system in the body: the immune system, digestive system, hormonal, pain, inflammation. So whenever I get questions from people on Instagram or when they apply for the program and they ask, well, I have this, can nervous system work help? I would say pretty much 10 out of 10, yes. it will help you. Now, depending on what your symptoms are, obviously I would figure out whether this is appropriate for you. But even if, so like, for example, even people, this has been shown to work on people with cancer. It's not treating cancer, but it is 100% helping the symptoms. People report healing in a much different way, having their pain and their mental health, well, their pain decrease, their mental health increase, essentially, when they go through this work. And so it makes the process of treatment so much better because we can decrease the danger signals and the stress in your nervous system so that your body doesn't have to send you even more pain and symptoms on top of cancer or whatever it is, even if you have. So, what's actually causing this and how do we heal it? The root cause, when your body keeps sending you pain, fatigue, and mystery symptoms, is the brain stuck in danger mode and a stressed out nervous system. You have, and you have lots of repressed emotions that are stuck in your body that are overflowing. And your body, you don't want to feel them. And that is not a you problem. That is society. That's what you've been taught. That's what you've been shown, that it's not okay to feel them, that it's not okay to be with them. Maybe you've been someone that have just stuffed down a lot. For example, time after time, women, many women over and over and again. Actually, it's really not just women, but a lot of women have been taught not to feel angry, not to be in their emotions, or that, oh, they're too much because they're feeling, right? I mean, we have long history of categorizing women as hysterical psychiatric patients because of how they feel and how they are in their own bodies and their own minds. And so we've learned to be the people pleasers, to say yes and thank you, and I'll do that for sure. I'll take care of it. And all along, we're just completely dismissing ourselves the whole time. Okay, that was a little bit of a tangent. Maybe I will do a whole episode on that. It's just an example. When we keep pushing ourselves down, our emotions, our opinions, our feelings, it stresses us out. It creates this really scared, fearful part of us. And that little girl who felt that fear very early on in life is still there and running the show. And so, to work with our symptoms, to help our brains and our bodies release the need to send us danger signals, to send us symptoms, is we work with our emotional capacity. We find safety in our nervous system and we build our tolerance for environmental stressors. We work with the deep fear about the symptoms itself, because when you've been in this for a while, it's not only what happened to you that brought you here, it's also what you're in right now that's causing so much stress in your life. The fact that you have to cancel plans, or that you don't even want to show up for plans, or don't even want to say yes because you don't know how you're going to feel. Your relationships suffer, your work suffers, your life suffers. You can't eat the things you thought that you were supposed to eat. All of this truly affects your life and creates even more stress and fear. And so that's a really big part of this process, as well as working with that fear. When those patterns are running the show, your brain and body live in a constant state of danger. And when your system feels unsafe, it adapts by creating symptoms to protect you. Even if it doesn't feel like protection, even if it feels like this isn't protection, this is effed up, this is shit, like my body's against me right now. No, it's protecting you. It really is. And we can start to understand what those patterns are the more that we understand how you've come here, how you got here. The good news is that protective wiring can be changed. Very, very much so. It can be changed. You can rewire the fear. You can discharge the stored emotions and stress, and you can gently teach your body a new way of responding. This is so powerful. So, actually, you know what? I want to describe a little bit of what I mean by protective mechanisms, because yes, it's protecting you because your nervous system doesn't feel safe, but let's give some examples. These might sound silly or irrational, but reminder that your unconscious, your nervous system does not operate on the rational level. It operates on the irrational level, like very much so unconscious, irrational, doesn't make sense, might feel dramatic. Okay, so maybe you got sick a lot as a kid. What was that doing for you? Was that taking you out of school that you didn't like? Or maybe you didn't have a lot of friends, or maybe you were bullied. Maybe it was the only time that your caregivers, your parents would give you attention, give you loving attention and take care of you and not question you. Those are just a couple examples of maybe what sickness or pain can be what we call a secondary gain. So it's protecting you from not feeling something, from feeling fear, from getting rejected. So it's sending you some signals to either shut your body down or for you to focus on them, right? Is your pain getting you out of things that maybe consciously or unconsciously you don't really want to do? It might sound kind of annoying or silly or like a little like icky in a way, like, ooh, I kind of feel like a child, like just trying to get myself out of things. And actually, that's not wrong. We are often operating on a childlike level in our nervous systems when we're in this state. So that's what I mean more by protection in terms of your body's protecting you by sending these signals, not only from environments and situations and experiences in life, but also from your own emotional pain. The pain you have felt over years and years and years. The pain you felt when you were a kid and you were rejected for wearing a certain jacket, or the pain you felt when your mom and your dad dismissed you, or the pain you felt when you never had the emotional capacity from your parents to sit with you and your emotions. That's some of the most difficult pain that a child can go through is that rejection. And then you feel alone and you feel very fearful. And you don't know how to express yourself because it was shown that it's not okay to do that. Or no one knows how to manage or feel them or be with you or hold that space for you. Your symptoms are covering up that pain, that kind of pain. Okay. I hope this is making sense. What I really want you to take from this is that, yes, you can have syndromes, you can have diagnoses, you can have things on your scans and testing, but it doesn't mean you need to have sensational symptoms associated with them. And the way out of it is through this work. It's exactly what I teach in the mind body healing method. We stop chasing symptoms, we stop trying to perfect protocols, and we start working with the root, which is your nervous system's protective wiring. The mind body healing method is a 12-week program to help you understand the science behind your systems, your symptoms, and to learn to regulate your nervous system gently. We help rewire the fear and protection loop that's keeping you stuck, help you understand and release some of the emotions that are stuck, and finally feel safe enough to let go of your symptoms and your pain. Because your body was never, ever the enemy. It's not the enemy. It's been protecting you all along. So we just want to help you build a better relationship with it. So if you're nodding along right now and you're like, oh my gosh, this is resonating, or you're kind of like, all right, I get it. I think I'm grabbing onto it. This is your sign. Not to try harder, not to add another test or doctor or appointment, but to try something different. Try mind body work. You can learn about the mind body healing method at the link in the show notes or reach out to me directly. I'm always happy to help you figure out if this approach is right for you. Remember, your labs might not have the answers, but your body does. So let's listen to it together. Thank you so much for being here, for being curious, for being open. Until next time, I'm Grace and keep healing with grace.